Hello, dear friends, hello, dear viewers, and my dear audience. I hope you will be doing well and enjoying well. So, dear friends, dear viewers, I welcoming you to my YouTube channel Good Life. If you are new on my YouTube channel, then I recommend you to like my video, share my video, and to subscribe my YouTube channel. So, dear friends, here we will discuss the different topics of Materia Medica from the first year course of Lady Health Visitors. So, basically, Materia Medica is a very important course for the different types of health students, like nurses, like nutritionists, like different types of other uh, students, etc. So the definition of materia medica is a Latin term relating to the history of pharmacy. The term materia medica was used from the period of the Roman Empire until the 20th century, but has now been generally replaced in medical education contexts by the term pharmacology. The materia medica is the branch of science which deals with the characters and uses of drugs. First chapter of Materia Medica is therapeutics, and the first topic is also therapeutics. So basically, therapeutics attends the science and art of treating a disease. If you have skills for the treatment of a disease, generally the diagnosing and the prescribing of medications are limited to physicians only. However, lady health visitors is the link between the community and the health facility is authorized to recommend certain drugs for common or minor conditions for which people would not ordinarily go to the physician, RHC or BHU for health, BHU for treatment. Neglecting minor or common conditions can lead to complications and unnecessary suffering. Therefore, in order to prevent these conditions from becoming major or complicated, you are authorized under standard operating procedures to recommend certain drugs. This chapter will deal with those drugs used in the management of common and minor conditions as well as other commonly prescribed medications. You need to become familiar with each drug that is frequently prescribed by the physician so that you can supervise and follow up those individuals taking them. In other words, you have three major responsibilities in the utilization of drugs. These are: number one, administrator medicines to prevent certain disease. Number two, recommending certain medications for common, minor, and emergency conditions. Follow up those individuals who are taking medications for disease treatment. In order to able to recommend certain drugs and follow up those person are taking other medications, you need to know the lady health visitor role in the administration of drugs, certain abbreviations, words and measures, as well as conservation methods which are commonly used in the administration of drugs, side effects, undesirable reactions, and contraindications to medicine and what to do about them. Specific information about each drug, including expiry date, category or classifications, name, condition it is used for, dosage and method of administration, lady health visitors activities specific to the drug. Common ways of measuring medicine. Basically, medicine is uh, usually measured in weight in grams and milligrams. Like 1000 milligram is equal to 1 gram, so 1000 milligram make 1 gram. 1 milligram is equal to 0.01 gram. 1 milligram is 1000 part of a gram. So it is important to know how many grams or milligrams are in a medicine. For example, if you want to give a small piece of an adult medicine to a child but you don't know how much to give, then read the small print on the label to see how many grams are in each tablet. For example, each tablet may contain 3 gram or 3000 milligram. If you want to give 0.075 gram or 750 milligram to the child, then you have to give 1 by 4 tablet. Measuring penicillin. So penicillin is often measured in units, like U is equal to units like 15 lakh unit, 1 gram or 1000 milligram. Many forms of penicillin, pills and injections come in doses of 4 lakh units, which is equal to 250 milligram. Measuring liquids. We can measure liquid medicine are often prescribed by a tablespoon or teaspoon. 1 teaspoon is equal to 5 ml, while 1 tablespoon is equal to 15 ml. So medicine can also be measured in the tablespoon and in teaspoon. Storage of medicine. Basically, medicine should be stored where children cannot reach, preferably a high place with a lock. Some medicines like antibiotic solutions should be kept in a cool place. Bottles and containers should be tightly closed and stored away from sunlight. Factors modifying dosage. So the dosage usually depends upon the age and weight of the patient. This is especially true for children, since it is impossible to memorize doses for all ages and weights that vary from the normal adult. It is necessary to read the printed information given by the pharmaceutical company on the medicine and follows it carefully. The third one is the routes of drug administrations. So the routes of drug administrations, there are many and different types of different routes of drug administration through which we can enter the drug into the body for the therapeutic uses. So there are about 4 main routes of drug administration, which are also further classified into many other um, types. The first route is enteral route of drug administration. The second one is parenteral route of drug administration. The third one is inhalational route of drug administration, while the fourth one is topical route of drug administration. So We will discuss these all routes of drug administration in detail in the next video. Thank you so much for watching my video. Goodbye and take care of yourself, and please do subscribe to my YouTube channel. Good Life.